You know, when I was hungry, I went and went to the chow hall, I grabbed a plate, and I walked down the chow line, and they put food on it, and I went and ate. And when I was done, I got up and left. When I had laundry to do, I put it all in a bag, and I dropped it off at a building. Came back 3 days later, my laundry was done. It's the simple life. It's dangerous for some soldiers more than others, but it's one of the things with reintegration coming back here that I've found out is, especially being a dad, being a husband, it's so much more complicated than it was in country.
When I came back, you know, I struggled, I think, with reintegration quite a lot.
It's 100% normal for soldiers to have issues, emotional issues, physical issues, some kind of hurt in any form. That's normal. That's okay.
Finally, I showed up at one of the Minnesota National Guards, Beyond the Yellow Ribbon. That was the kind of the first step towards getting hooked up with all these resources that I now have.
Joining Forces, Home Again is a co-production of Health Partners Institute for Medical Education, a nationally recognized provider of continuing education for health professionals, and TPT's Minnesota channel.
In the summer of 2007, Minnesota welcomed more than 2,500 soldiers home from Iraq. These soldiers, primarily members of the Minnesota National Guard, served their country with distinction, and we thank them for their service. Now that these men and women are home and with their families, friends, and neighbors, the real work begins. The tearful welcome home parties are but a memory. The slaps on the back and the kind smiles have faded a bit, and now returning to a way of life classified in military circles as the new normal has begun. There are a number of issues that are presented at home, at work, and in the community, and we'll touch on some of those. A primary focus of this program is to look at how the medical community, those on the front line when it comes to treating the returning soldiers' illnesses here at home, act and react to issues that are presented when treating and caring for a patient who has served in active combat. With us today to look at the experience of welcoming a soldier home from the standpoint of a family and a medical community are Chaplain Lieutenant Colonel John Morris of the Minnesota National Guard and Colonel Dr. Basil LeBlanc is a practicing physician and the state surgeon for the Minnesota National Guard. Gentlemen, welcome. Always good to see you.
Thank you.
Thank you.
Thanks for having us.
Well, Dr. LeBlanc, I'm going to start with you first. The important issue of reintegration, why is it key to keep pushing this forward?
Based on sheer numbers, primarily, Kathy, if you think about the thousands of soldiers now that have been in combat and all of their families and employers and communities, we are talking about a large number of people that have been affected.
And because of this large number, what are some of these experiences that you've been hearing about, both on the battlefield and when they come back home?
We've now had the Brigade Combat Team home for about 60 days, and some of the issues are starting to emerge. They have been screened a couple of times already, but of course their first interest was getting home, and so they may have glossed over some of the issues that arose, and frankly they may not be aware of some of them yet, and so we continue to screen them. But some of the issues, of course, are related to the stresses and all of the readjustments that have had to occur since returning home.
Chaplain Morris, from your standpoint, why is it important to continue to focus on a reintegration?
Kathy, we've trained tens and thousands of Minnesota natives to be warriors. And then we've sent a select group of those Minnesotans into combat, and they've used those warrior skills. We've provided them little to nothing in how to become a citizen again. So we can anticipate this will have a societal impact on all of us when we take warriors from combat and then ask them to assimilate back into our communities, become productive citizens again. And we're going to see that in a big way here from this Brigade Combat Team and from all the Marines, sailors, and airmen that are returning into Minnesota. the more we can do to help them become productive citizens, the better it'll be for them, their families, and for the state of Minnesota.
I'm curious, their experiences both in training and in war, what are some of those things that you've heard that they've experienced that would make readjusting a difficult proposition?
The most common issue I say to people, and it's intuitive if you think about it, we're institutionalized people. When we put this uniform on, we surrender most of our freedom. We enter a very hierarchical, authoritarian organization that does most of our thinking for us. Now, in the case of this brigade, if you for 22 months live in that kind of an environment, you're going to adapt to some institutional behavior. And then within 300 hours, I give you your freedom again. We can anticipate people reverting to institutionalized behavior in a very complex world. So I give you a very silly example. Soldiers love to hear this. They laugh their heads off. If you come to one of our reintegration events, if I start a line somewhere, soldiers will gravitate to that line without being told, not even knowing why they're in line, because we do lines well. It's institutional behavior. Well, that gets to be a real problem when I throw you into the global economy, I throw you into the complexities of a family. How do you readjust with no training?
I'm curious, Dr. LeBlanc, because you've been over in Iraq, how tough is this adjustment?
It's going to vary widely from soldier to soldier, and it's going to depend on what kind of experience they had. But truth be told, you take any soldier away from their family for 2 years, and there are going to be major changes in that family structure, community structure, and as Chaplain Morris just said, they're extremely well trained, and they have many skills that were critical to keep them alive. However, those skills don't always translate very well into the civilian population.
I'm wondering, have you heard from some of the soldiers coming back this hyper-vigilance? Because when you're in a war zone, you've got to be always looking who's behind my back, who's to the side of me. How is that affecting the readjustment?
Now that's a peculiar malady for those who are in the most dangerous jobs. Not everybody has those dangerous jobs, so it's not all soldiers coming out of Iraq and Afghanistan. But those that had to drive convoys every day, they're the most common people to report this problem, and it surfaces mainly in traffic for them because they drove hundreds and hundreds of thousands of miles, wired very tight, very vigilant, looking for bombs. Well, how do you turn that off when you're driving through downtown Minneapolis, St. Cloud, Fargo, Rochester? You can't. And they'll report early on being very uncomfortable in traffic, very uncomfortable in crowded places where they don't have control. And that can come all the way back home to the living room. Very uncomfortable with little children, screaming, not being able to be appeased, not being able to pacify those. And so I regularly have spouses report to me, I left to go shopping and my soldier begged me to come home within 30 minutes. Couldn't handle the kids. Now this is a soldier that could handle 10 vehicles in a convoy, move massive amount of material across Iraq. 2 little kids overwhelmed him in a matter of 30 minutes. Okay, I've gone from an environment where I've had a lot of control and I've been able to exert my control, been very vigilant for danger, to an environment where I don't have the training to handle these 2 children. They're screaming, they're overwhelming, I feel threatened. Everything's going off in the alarms in my system, and what do I do?
Well, and from the medical standpoint, in the civilian medical community, what do you tell your colleagues about helping some of these soldiers?
I think the most important thing is that they understand that that issue is out there. And so simply to ask the question, were you in the military, and if so, were you in a combat zone? And that at least identifies that population. And then hopefully you've gotten more information and some training in what specific issues you need to look for.
You know, I want to move on and ask about some of the patterns, behavioral patterns that soldiers go through once they get out of a situation and they're back home. Is there any typical pattern at all?
If I could graph it, I'd say most people have a honeymoon phase. For some people it lasts a day because they're coming home to real challenging problems. For most people it can last a month, 2 months. Life's great. I'm home, I'm alive, everybody loves me, the family's supportive, people come up and thank me for my service. And then comes the realization of reality. I go back to work, I go back to school, and I begin to re-engage society. And that brings a whole host of new issues and challenges that startle soldiers.